Well,
May I just answer one question regarding how it would be affected? It's a declaration at the point of registration that you are doing these things. And what we have here, and I know it's very confusing still to me, Senator Roth, but there you have group homes, 6 and under, that can come together, a group of people who want to stay sober and they're helping one another. That is not what's happening in these communities. That is defined by those 6 individuals or 6 or less signing the lease, agreeing to work together on their problem and cohabitate. So that's separate from this. That's not how these are operating. They are being referred from a treatment facility to a sober living home that's managed by the business, the organization, agency that basically does this. So they are buying up homes throughout many communities throughout the state, and they are putting the people who are in their treatment facilities in these homes 6 at a time with an individual managing them, so the house mother. But because they are actually driven from those homes to a treatment where they receive their treatment and then return to the sober living facility, they have fallen between the cracks. And they are growing in numbers, and the people in them, many I do not believe, based on in my own neighborhood, are really being treated in the manner they should be and being the protected class and being helped through their addiction. And in some instances, when there are a proliferation on a block, you basically have a campus in the center of a residential neighborhood that's a treatment facility, essentially. So what can we do? Where can we close the gap? And there have been so many attempts at doing this. I actually kind of jumped on this one because it managed to get through all of the stakeholder groups, all of the regulations, federal and state, that affect all of our states in Arizona because of a very similar problem, not a problem with doing what we need to do to help these people, but the fact that they are not doing that, and it's really become a business, a very, very lucrative business. We're talking $30,000 to $50,000. They are getting insurance through ACA for a number of those, and that was actually determined in Costa Mesa, what the benefit was, what the revenues were, and that's okay if it's doing the job. But when you're able to navigate a system that's got all these loopholes in it, and the focus should be on the patient care, we're trying to find a way to do that. So if I go in, I'm going to start one of these, I register, and I agree that I'm going to be providing these within my structured home, fine. The day that there's a complaint from the neighbor that this isn't happening, then I have a right as a city with my public works, my enforcement group, to go out and see, what's happening or what's not happening. And I think it's just a permissive thing, but it's a step to try to close that loophole.
Right. Well, by the way, not only are you an exceptional senator, but I certainly recognize your expertise in this particular area, your background. I just have one final question, Mr. Chair, and I guess maybe this goes to the league. Given the fact that this requires ordinances that deal with establishing in-home supervision requirements and various assessments, is this a state mandate?
This bill authorizes locals to establish it, so in this case, no.
It's permissive.
So let me characterize, and because I think I may have misspoken earlier, I thought, and I was in the understanding that because we're going to be doing these activities, requiring is that we would be licensing the facilities as well. And I think that my staff had reached out to your office to put it under, under the Department of Licenses. I've just been notified that you weren't going to be putting that provision in. So in that case, and I definitely have concerns, and I was thinking that we were going to be licensing the facilities. And this is very similar to what Nastandi did, and what we had asked and was willing to work with him as well. And I know we're kind of at the last minute, but, anyway, so let me clarify that. So I think Los Woke, well, actually, Senator Hall had a question first, then we'll go Los Woke, and then we'll go Bill.
Thank you. We have a chronic homelessness problem in California. And thank God we have some businesses that are able to place some of these individuals that are going through treatment. But for the treatment or the homes that are providing shelter, 4 or 5 people cobbling their monies together to be able to pay a rent, if you will, they will be homeless. They would be homeless. And we, in my community, and by the way, Senator, I don't know, what cities do you represent?
South Orange County, North San Diego,
What cities?
Oceanside, Vista, Carlsbad, San Juan Capistrano, San Clemente, Dana Point, Laguna Niguel, Laguna Hills, Mission Viejo, Rancho Santa Margarita, and the unincorporated areas within that same.
Well, I represent Watts and Compton and Wilmington and San Pedro and South Los Angeles and that area, different socioeconomic community and certainly demographic. And absent, the homes in certain communities being able to provide these services or at least shelter, those folks will be coming down to my community certainly, and we'll be taking care of them because they will be homeless. And I don't think, quite honestly, cities should have a right to say who should and should not live in their respective communities. Or at least the state should not pass an order or a law saying that, we can be selective as to who live in our community. By the way, the cities already have the right to pass an ordinance, a noise ordinance, an abatement ordinance, and so many other things to be able to handle the problem that you are trying to address here. Quite honestly. Right now, we are passing, trying to move through the budget funds to help accommodate our homeless population in California. In Los Angeles alone, proper homelessness has gone up some 20% in the last year. In my district, 34%. And if we get the more affluent communities outlawing these type of homes, then these folks will be coming down to our communities. I think we all need to share the burden. What makes one person better because they live in one area than me who lives and represent my great community that I happen to love of South Los Angeles? We are all equal. We all pay the price. And so I will not be supporting any legislation that will pick winners and losers in California. Thank God that there's a place where 4 and 5 folks can shack together and take care of themselves and try to make right their lives, because absent that house, they will be homeless. And we'll be paying for it through different type of services, public services that we have to provide that some of our friends to the right would vote against. So I will not be supporting this bill, and I'll be urging my colleagues to join me in not supporting this piece of legislation. Thank you, Mr. Chair.
Senator Wolk first, or was it? So you pass Senator Money.
Thank you, Mr. Chair. Well, I want to thank the author. I mean, you've framed and helped to describe a challenge that many communities face and a gray area that exists. I, however, see these facilities, my understanding, they are not treatment facilities. Most of the folks that end up in these sober living homes have gone through a treatment program or they're going through a treatment program, but it's not happening in the living facility. So it's a group who voluntarily have chosen to live together because it's a sober environment and they provide mutual support, whatever. But it's really no different than a group of students in a college community who band together and agree to live 4 to 6 in a home or apartment complex or whatever. I think the concerns raised by the Western Center, where we have court decisions saying that because of the fragile nature of this community, it is considered a suspect class, somebody who's dealing with drug or alcohol addiction. And as such, the courts have said any special treatment of that community falls under a strict scrutiny test, so that if we as a state or as a local community, if we authorize local community to treat that group of that class differently than the neighbors of a group of 6 students who are living together, then we run afoul of the protections that have been designed. So that's what I'm struggling with. And again, with all due respect to what you're grappling with, that it's not black and white. But I do think that for some of the examples you shared, if one of these group homes falls into disrepair, or they're not discarding garbage, or there's abandoned vehicles on the front lawn, we have existing ordinances that apply to them as they do to their neighbors. And they're not protected from those laws or ordinances that are applied to all residents in the community. So that's why I have a problem with potentially not the intention of the author, but a potential consequence of a community of people who have gone through or are going through a treatment program not in that house, but have chosen to live together to pursue their future and intentionally be in a safe environment. So I will not be able to support it today. I am very open to figuring out how, as we move forward, as we hopefully find greater support for all forms of treatment, including access to safe living places, that this may raise to a level of licensure and is seen as part of treatment and is then caught under that umbrella of licensure that would allow for the type of oversight or regulation that I think you seek. So again, that's my understanding. This has been a helpful conversation, but I think we need to recognize that this group of people, they're not living in treatment facilities, even though there may be a nexus with actual treatment. So thank you, Mr. Chair.
Thank you. Anyone else? Comments? Senator Nielsen?
This issue is not just related to treatment for alcohol and substances. I've lived with it my whole career, dealing with all kinds of facilities and all kinds of rural, suburban, and urban communities that I've represented. And there are always sort of objections. We don't want this, we don't want that. I've represented areas that have not wanted farm worker housing, but their very existence, or why people wanted to live there, was because, oh gee, it was very nice to have these wonderful agricultural practices there, and we like to be there, but we don't want those farm workers to have those houses there. We all have our thing. Now, I don't look at this legislation as anything to be characterized as that. I look at it as reasonable local planning and not exclusively. And I think it's an attempt to struggle with an issue that we've all dealt with in a constructive way. And I credit Senator Bates for a problem-solving attempt here. And I'm willing to make a motion for the bill.
We have a motion by Senator Nielsen. Seeing no other comments.
May I just make a
we'll
closing
let you
comment?
close, but-
Because I want to clarify for the record, with all due respect to Senator Hall, many people don't know the community character in my district, and I did participate in the homeless count of 2012, I think it was. We have a significant number of people who are homeless, and I will share with you that significant number of people who are homeless are also very addicted to a variety of substances. We all know that that's the underpinning of our homeless issue, a huge proportion of people. So I just challenge you as we go forward, and you'll see some other bills. There were 2 bills that passed out of the Assembly yesterday that do deal with the same problem. They might have a little more that you can get on board with. But I challenge you to focus on the issue here. It's talking about a protected class. And I believe it is our mandate to ensure that they are receiving the kind of environment the kind of treatment, the kind of neighborhood that will help them move to recovery, or they will relapse and they will be back out on the streets, they'll be under the bridges, and they will be homeless again, because a lot of them that are in these have come from that very environment. So bear that in mind as you look at these going forward. This was an attempt to provide a pathway to navigate all of the loopholes that seem to be here. If it doesn't meet muster, we're certainly open to any amendments you'd like to suggest or to revisit it, but it is definitely something that we have to get our arms around. It is clearly a huge component of the problem that we see in this state of homelessness and drug addiction.
And I don't disagree, and let me just reiterate my first comments, because I was with the understanding that you were going to be taking amendments to license it similar to what we did with the Nastani bill. My understanding is that you're not. Because of that, I can't support it, so I'm assuming you won't be taking amendments similar to what we did with the Nastani bill then?
Well, if you give me another week, you want to not take a vote, I will
I don't know if
certainly
we
discuss
can,
that.
we're up against, and the reason why I made the comment I did is because I had told my staff that I can't support the bill in its current form, but if they'd be willing to look at it to how like we modeled it in the Nastani bill, and that's why I thought you did, so.
We didn't, Senator Hernandez, specifically because we saw this Arizona success and thought that must be something, because many of the companies that operate these rehabilitation facilities were supportive of that. They felt that that was a way to navigate in the communities the issues that continually arise over whether we should have
Here's
business.
the dilemma we have is, I think we're up against the deadline because this is a fiscal bill, and especially if we amend it such, it'll be that way. So therefore, I don't know if we have time,
It's non-fiscal,
but if we,
my staff just told me.
but if we amend it such to be licensed, then it'll become physical, then we're, I mean, that's the dilemma we're gonna have. So in its current form, I can't support it, and that's why we reached out to you to change it to be physical, you know.
Well, if you want, don't take a vote and you give me an opportunity,
But see, that's the dilemma, is even if we don't take a vote and we amend it, then you're past the deadline because the physical deadline is this week.
oh, sorry.
That's
I
the
thought
dilemma.
it was next week.
No, it's this week, and that's why I told my staff to approach you to amend it, to make it physical, to go to appropriations, then I would have perhaps supported it. So anyway, so I'm assuming that's your close. Okay.
Thank you.
So we have item number 9, SB 1283, do pass. No amendments. Call the members, please.
Hernandez? No. Hernandez, no. Nguyen? Hall? Mitchell? Monning? Nielsen? Nielsen, aye. Pan? Roth? Wolk?
Okay, it's 1-1 right now. We have some absent members. We'll place that bill and call.
Thank you very much.
I think it looks like Carol Liu, item number 13, SB 1384, California Partnership for Long-Term Care Programs.
Sorry we took so much time.
Good afternoon, Senator. Welcome, and please proceed.
Thank you, Mr. Chair, members. First, I want to thank the committee and consultant for his work and assistance on SB 1384. I'm pleased to accept the recommended amendments. By 2030, people 65 years and over will comprise almost 20% of California's population. Projections are that 70% of those will require some form of long-term care services. But research shows 67% of seniors underestimate their future needs. Some also believe that Medicare will cover any in-home care services they might need. It will not. Long-term care insurance is one way people can protect their assets from being exhausted by long-term care expenses. But with increases in longevity, long-term care insurance premiums have become unaffordable for most middle-income consumers. Nonetheless, these consumers have too much income to qualify for Medi-Cal. California created the Long-Term Care Partnership in accordance with federal law to help fill the LTCI gap. But by all accounts, the program is failing. The Long-Term Care Partnership Program is a joint federal-state initiative intended to expand access to private long-term care insurance. Purchasing a partnership qualified long-term care insurance policy provides dollar-for-dollar asset disregard or spend-down protection. Individuals who purchase a PQ policy earn $1 of Medicaid asset disregard for every dollar of insurance coverage paid on their behalf. Sales of regular individual LTCI and partnership policies have declined nationally, but California has been hardest hit. In 2004, 13,369 consumers applied for partnership policies. 8,425 were approved, but only 858 applied in 2014, and of those, only 611 were approved. SB 1384 addresses major concerns with the California partnership that I hear repeatedly from LTC stakeholders and insurance policy providers. It takes too long for policies to be approved. The product design requirements are not flexible enough to meet consumer needs, and these requirements make the policy too expensive. So SB 1384 does four things. It shifts responsibility for the approval of partnership policies from the Department of Health Care Services to the Department of Aging. The Department of Insurance retains its authority to approve policy provisions and rates. It provides lower-cost LTCI options to be developed, such as inflation factors lower than 5%. And the consumer is to be informed of various policy options and their comparable benefits and costs. It also enables the development of policies that cover institutional care only, in-home care only, and comprehensive coverage. And it provides that electronic and other devices for monitoring health and safety of the insured be covered by in-home care only policies. SB 1384 is a work in progress. I've reached out to all stakeholders, insurers, agents, consumers, advocates, and the state departments involved, soliciting their input and recommendations for making the partnership a viable program and enabling more of our aging population to age in place. So I respectfully ask for your aye vote.
Thank you. Anyone like to speak in support of the measure? Yeah, there is support on both sides. Thank you. Welcome.
Thank you very much. My name is Louis Brownstone. I'm the chairman of California Long-Term Care Insurance Services, a specialist long-term care insurance brokerage. And I've been doing this for 25 years and have a fair amount of knowledge in this field. I come to you not representing my brokerage, but as an individual, very concerned about the impending catastrophe that's going to befall Medi-Cal if long-term care insurance doesn't become a viable product in the state of California. I think it's pretty rare that you can enact legislation which can save the state of California as much as $20 billion from 2030 to 2050. But that's the mathematics. That much can be saved by just increasing the percentage of people in California who have a long-term care plan from the current 6 or 7% to 12 to 14%. Most Californians will become sick as they age and will need the leverage of a long-term care plan in order to avoid becoming wards of the state. Long-term care insurance market has recently undergone major revisions, resulting in increasingly high rates and a variety of new product designs. Our 20th century laws are outdated and have contributed to inhibiting the sale of these products to the middle class. It's urgent to pass this bill right away. Some of its elements have been in the Department of Health Care Services for over 2 years. We need to revive the California Partnership for Long-Term Care, one of the nation's first private-public long-term care insurance programs. Change existing regulations to make partnership policies more affordable to the middle class, including allowing lower inflation rates, providing design choices, and increasing public education. Move the partnership out of the gigantic Department of Healthcare Services if necessary in order to increase oversight. Attract new carriers. Existing rates show how impractical the current partnership regulations are and why the product is not selling. Out of a potential audience of close to 1.8 million who can afford this insurance if it were sold properly, 500 or so bought it last year. A total failure. This is only the start of what needs to be done. We need to have a continuing dialogue with the goal of establishing a new private-public long-term care insurance program. Like the current partnership program, private insurance would pay the first benefits and Medi-Cal would pay the catastrophic benefits, with some participation where possible by the policyholder. Virtually all of the think tanks now endorse such a program. I'd be very happy to work with you individually and with your staff individually, either in Sacramento or in your districts, in order to impart information about what needs to be done to make long-term care insurance viable and save the state many billions of dollars. Thank you very much for your attention.
Thank you. Anyone else in support? Opposition? Questions, comments? We have a motion by Senator Wolk. Would you like to close?
I simply ask for your aye vote.
Thank you. We're on item number 13, SB 1384, due pass as amended to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
Currently has 4. We have members absent. We'll put that bill on call.
Thank you, Mr. Chair, members.
Thank you. We're on item number 14, SB 1420, Mendoza Child Care and Development, Occupational Health and Safety Training.
Mr. Chair, members, I'm here to present SB 1420. This is a vital bill to protect the health and safety of early educators who do the tough and sometimes literally backbreaking work of caring for young learners ages 0 to 5. Let me begin by stating that this bill is a work in progress, and we are working with several state departments to move forward the best piece of legislation possible. We appreciate policy comment number 7 in the analysis. We are having conversations with the California Division of Occupational Safety and Health and look forward to starting a dialogue with the Department of Social Services. The intent of this bill is to require all licensed caregivers of children to complete a one-time training on occupational health and safety risks specific to the child care profession. Child care providers have high levels of on-the-job injuries. This is critical. This is a critical concern for our state. A study after study documents that child care quality is most dependent on the child care staff working with children. If a child care worker is injured, child care quality is likely to decrease. Anyone who has a toddler knows how easy it is to throw out your bag picking up a 30-pound child, especially when he or she is kicking and squirming. SB 1420, the Early Educator Occupational Health and Safety Training Act, feels a critical need to keep child care workers injury-free with a common sense preventive approach. This bill helps every child care worker, both in family child care and center settings, have the training he or she needs to prevent injuries and provide a safe environment for children in his or her care. This bill helps our state meet the new federal requirements through the Child Care Development Block Grant to provide consistent training across all child care workforce. SB 1420 recognizes that the people who do some of the most critical and hardest work in our state deserve to have the education to ensure their own safety at work. I have a few witnesses in support.
Thank you. Good afternoon and welcome.
Good afternoon, Mr. Chair and committee members. Michelle Cass with the Service Employees International Union. We are the sponsors of this bill. In the interest of time, I'm going to defer the rest of my time to Tanya McMillan, one of our members, but can be available for questions. Thank you.
Thank you. Good afternoon. Thank you for inviting me here today. Like she said, my name is Tanya McMillan. I am a family child care provider from the city of Bellflower. I'm the co-chair of Raising California Together Coalition, and I'm a proud member of SEIU Local 99. I've been providing quality child care services for over 20 years. A few years ago, I strained my back carrying an infant in my care. And let me tell you, you do not realize how much your back impacts the work that you do until you hurt your back doing your job. Singing, playing, teaching my early ed curriculum is excruciating when you're in pain. The worst part is not being able to hug your child goodbye each day when they're walking out the door. When I was injured, I was lucky to be able to keep working even though every step was painful. But I worry about slipping or tripping that could put me out of work for a day and cost me my living. Beyond strains to muscles, we spend 10 or more hours a day. I personally work 13 hours a day around young children who are amazingly cute, but let's face it, they have a whole lot of germs, more than older kids and adults. And although those germs are worth it to me, they're still a hazard to my job, especially when I'm left deciding what kind of cleaning materials to use that can have toxic side effects on me. Finally, dealing with stress is a major part of my job. I have stress about keeping the children in my care safe. I have stress about ensuring I'm meeting each family and child's needs to develop and thrive. And I have stress about worrying whether my low pay will cover all my bills and whether my pay will even arrive on time. And those are on good days. Child care providers don't get sick days. We can't leave children in our care behind to go to the doctor. To do our jobs, we have to remain healthy and injury-free. I'm proud and I'm grateful that Senator Mendoza has put forward this bill. I happen to live in one of his districts, so he's my senator. SB 1420 will give child care providers and center workers the opportunity for training that can help us take care of ourselves and the young bodies and minds that we care for. More than 95% of child care workers are women, so this bill is important both to deliver training, but also delivering dignity that our work has been lacking. Whether we work in a child care center or a home-based daycare out of our homes, our work is vital to the families we serve, and we are a critical link to the learning that California needs to help disadvantaged children succeed in school. But our jobs have not been treated that way. Those of us who work in our homes earn just 1/3 of California's new minimum wage. We don't have workers' compensation insurance or the protections that California has championed for wage earners because we are independent contractors. In other words, we are considered employees to no one. Your vote will help us do the child care jobs California is counting on and send a signal that California is standing up for child care workers who are vital to our future. Thank you for allowing me to share this today.
Anyone else in support?
Dion Erider on behalf of SEIU and United Domestic Workers in support of the bill. I'm really here just to answer any questions. I did want to point out that there was a significant comment made by the consultant, and by the way, an excellent analysis. Thank you very much. The very last comment in regards to saying, shouldn't this be in the Health and Safety Code? And I think probably the senator addressed it. The answer is yes. And we actually have proposed amendments to do that, to put it in the Health and Safety Code under the licensing provisions, because that's who should be holding the providers accountable for whether or not they received the training. And also we're talking to Cal OSHA about whether or not it would be more appropriate for them to be involved in the curriculum development and the choosing of the agents or whatever you want to call organizations that are going to provide the training. And we are talking to both of those departments.
Thank you. Anyone else in support?
Mr. Chair, member Sarah Flox, California Labor Federation, also in support.
Thank you. Opposition? Questions, comments? Any questions, comments? We have a motion by Senator Monning. Would you like to close?
Mr. Chair, members, I respectfully ask for your aye vote.
And understanding that we will take those amendments that you were talking about in appropriations. Is that correct? Okay. So we're at item number 14, SB 1420, Mendoza. Do pass 2 appropriations. Call the members.
Hernandez.
Aye.
Hernandez, I. Wynn. Wynn, I. Hall. Mitchell. Monning. Monning, I. Nielsen. Pan, Pan, I. Roth. Wolk, Wolk, I.
Currently has 5. We're going to, enough to get out, but we have some absent members. We're going to place that bill on call.
Thank you.
Thank you. Looks like we're at Senator Monning. Item number 11, SB 1339, Public School Service